Indiana's youth suicide rate has been higher than the national average since 2000, and suicide is the second leading cause of deaths for Hoosier adolescents. So what are some of the steps being taken to reverse those trends? That's next on WNIN Newsmakers. Welcome to WNIN Newsmakers. I'm April Nading. A new documentary sponsored by Riley Children's Health spotlights the issue of youth mental health here in Indiana. Here to discuss Riley's initiative to respond to these sobering statistics is its president, Gil Perry. Thank you so much for being here.
Thank you for having me.
So what should people expect when they see this documentary?
It gives us an opportunity to really share the journey of two families who unfortunately have had traumatic events happen in their life related to mental health. It also allows us to really educate the community about the crisis that is the national crisis, and Indiana unfortunately is not immune to that crisis. And so we're really grateful for the opportunity to spend 45 minutes with our community across the state. We're doing 6 screenings in different communities, kicking it off here in Evansville on October 10th, to really educate the community about this crisis and, more importantly, what we're going to do about it.
How did you decide to kick it off in Evansville?
We have had such a great partnership with Bob Jones, Dr. Becker, Dr. Just. Here in Evansville, you guys have been talking about youth mental health for a long time. Youth First is a leader within the state. There's a lot of great activity here. So as we started developing the strategy, we identified Evansville as a community that is already all in on this topic, and we wanted to honor that by kicking off the statewide screenings here in Evansville.
Oh, well, that's great. Now, most people think of Riley's when it comes to chronic health issues or urgent care needs. So can you talk a little bit about how Riley's can help with the mental health of children in Indiana?
Yeah, Riley Children's has always been one of the top children's hospitals in the country. We're always known for the medical and surgical professionals that we've been able to recruit here to Indiana. We're amongst the best in the country and thankful that we are great in that space. Increasingly, we know to really care for children, we need to continue to focus on mental health and prevention. And so we've always had those services, and we have an emergency stabilization unit, we have an inpatient unit, we have a lot of outpatient services for mental health. But what we've decided to do is to partner with the state, 220 stakeholders from throughout the state, to create a statewide plan for youth mental health. And that just finished about 3 months ago. It was a 9-month planning process where we engaged all stakeholders to identify what is the roadmap for a different future related to youth mental health in Indiana. So we're grateful for the opportunity to partner with the state, with all the organizations who care for kids, in crafting a plan to go forward so that we can improve the youth mental health in Indiana.
So the statistics surrounding the mental health of young people, especially in Indiana, are very concerning. I mean, when did you realize you needed to do more? I know you said you started planning this 9 months ago, but is that when you realized it, or?
Yeah, youth mental health has been a challenge for many, many years. The pandemic exacerbated the challenge. There are many reasons and evidence of why that's happened. But what we've identified is if we don't address this challenge, we're going to have young adults and adults who are not healthy from a mental health perspective. And so we know that investing in children early and addressing mental health needs early create healthier adults. And so we identified this as a strategic priority. If we're really going to be caring for the health of kids, we have to also care for their mental health. And so it was something that we've been working on for many, many years at Riley. We've had some of the best experts in the country join Riley in this space, and we're going to hopefully attract more.
So I guess expanding on that just a little bit, so there's a correlation, obviously, is what you're saying, that if they have mental health issues as a child that they could maybe do something about, then it can help them as adults to help keep it from getting worse, maybe?
Yes, the strategic plan, which is an evidence-based plan, we looked at all the literature that is communicated around youth mental health. We went and did site visits across the country to identify who's already doing this really well and getting the outcomes that we all aspire to. And what we identified is the more you can invest early on, specifically in schools, in prevention, in outpatient services, intensive outpatient services, the less you need to worry about inpatient hospital beds for youth mental health. That doesn't mean that we don't need more beds here in Indiana. We do. But our focus around the state is going to be really focused on integrating behavioral health professionals in primary care practices, working with the schools, with parents, to go early on to prevent the need for an inpatient bed. There's always going to be that need. We have, unfortunately, some kids who have significant mental health challenges who will need inpatient capacity. The other thing the strategy calls for is workforce development and really making sure we have attracted professionals to come into this field. One of the challenges with access across the country is there's not enough professionals to see these kids. And so we need to create a workforce, and Evansville has put a stake in the ground as identifying the workforce capital for this mental health professional. And we're going to be working together across the state, but Evansville being one of the hubs, to attract professionals into this field. We also need to create a sustainable model for reimbursement so that we can have professionals who can have a fair wage in order to continue to serve kids in this space.
And when you say Evansville has put the stake in the ground, which is very good to hear, who in Evansville, who in the community has done that?
About a year ago, Bob Jones and I had a conversation about what we can do that's big and bold. He's always been a passionate Evansville leader and has always been a fan of Riley Children's and all the work that we do. And we collectively worked with Mayor Winicky to convene a group of key leaders within Evansville, university leaders, corporate leaders, et cetera. Dr. Steve Becker from the IU School of Medicine, Evansville, all convening to identify what is it that we can do. And from a strategy perspective, we've identified workforce development as a sweet spot where Evansville can really make a difference. We have already a lot of assets down here in Evansville through the School of Medicine that will enable us to be successful in this space. And we do this all the time on the medical and research side, and now we need to do this on the mental health professional side. And so I'm really optimistic. Bob Jones and the mayor were able to convene literally within 2 weeks all the university presidents in Evansville to come to a meeting. That doesn't happen very easily, and it speaks to the collaborative nature here in Evansville and why I have so much optimism that we're going to make a big difference.
Well, that's great. Now, let's talk about the screening that is going to be in Evansville. I mean, where is it? Is it open to the public?
Yeah, the screening is October 10th at 5 o'clock. It's going to be at the Bally's Event Center. It's free parking, free event. There'll be refreshments, and it's open to the public. We have plenty of room to welcome anybody who's interested in this topic. You can register online by going online to register, or if you don't register, just come on in. We'll have plenty of room for those who are interested in seeing this. Again, it'll be a 45-minute documentary, and then we're going to have a panel with local experts talking about this topic and what we're going to do about it. And so the documentary is heavy. It really helps track two families whose journeys, unfortunately, were very challenging. And we walk through that, and we talk about the challenges in the youth mental health space, and then we're going to have a panel to talk about the strategy of what we're going to do about it. So we're really excited. October 10th, 5 o'clock at the Bally's Event Center.
Who would you recommend watching this?
We recommend all families, so parents who have kids obviously would be interested in this topic, schools, corporate leaders, anyone who's a leader and who cares about the future of youth. This is what is critical for them to hear. It's a powerful documentary. It has a lot of statistics and evidence. We have experts from Evansville and throughout the state that really share the crisis and what we're going to do about it. And so we invite anybody who's interested in youth mental health to join us, and hopefully we'll be able to see you on October 10th.
Okay. Well, thank you so much for being here. I'm anxious to see the documentary.
Thank you for having me. We appreciate it.
Talk about what they've seen locally on the youth mental health front is Tracy Kelly, a staff therapist at Southwestern Behavioral Health here in Evansville. Thank you so much for being here.
Thank you for having me.
So tell me a little bit about Southwestern Behavioral Health and the people that you serve.
We've been around for a while, started in the early 1970s, have grown into a company of 300 or more employees. The fastest growth has been in child and family services. We're now the largest division, and we have offices all over the place, here in Vanderburgh, Posey, Gibson, and Warwick counties. We've just added a new neurodevelopment clinic to assess and coordinate care for children with developmental disabilities. It's been new to us because we didn't do that for years and years and years. And so that's the latest edition.
What made you realize you needed to do that?
Not being in the offices and making those kind of decisions, I'm just a therapist that works in there. We ended up with some grant money. We are trying to qualify for a CCMHC, I believe that's the initials, from the federal government, change what kind of mental health center we are. And so there were some requirements of who we serve and how quick we get people in and what services we provide. That was part of all that grant.
So we've heard some of the statistics about the mental health of the youth in Indiana.
Right.
What are you seeing locally as far as mental health with youth?
Locally, one of the things that we noticed is when the pandemic hit and they did the lockdown, we all went, we're going to have a lot of depressed kids. And so we all geared up for all the depressed kids that were going to come into the office. And that didn't happen. Throughout the 2 years that we had this pandemic governing what was going on, we really didn't see that big explosion of depression. But then they opened everything back up. And we found out that all of these kids that have been locked away now have a lot of mental health stuff. We see a lot more anxiety because they're having to get out and mix. They have to produce where they weren't producing when they were working at home for their schooling. They have to re-engage in social contact, which they really weren't doing. So we see a lot more depression at this point. A lot of kids struggling to gear up and actually produce in school. So there's all kinds of issues that came out of the pandemic that we're just now seeing the super flow of that happen.
So do you think it was that these were kids who just functioned better without having to be engaged? Or was it that they were doing all right, but then because they lost that ability to engage?
Well, I think anytime you deal with somebody who's anxious, if you avoid your anxiety, it becomes stronger. So if I fear going out my door so I don't go out my door, my fear gets stronger and stronger until I choose to challenge that and hopefully have success so that it gets less and less. So all of our anxious kids that really were uncomfortable in social settings, godsend. I don't have to go to the social settings. I can just sit at home. I'm on my computer. I'm playing my games. I don't have to meet and greet with anybody. But then when everything opened back up, I don't get to sit back home. And I have to face that anxiety. And when you first start that, that's a very, very stressful thing. And I think a lot of kids ended up in trouble when they had to re-engage after disengaging.
So it really was an after effect of COVID. And,
yes, very much so.
And it's still 3 years later, I guess you're still seeing that continue. I
haven't really seen a let up on that. I still have lots of kids that are struggling to perform, struggling to get back into social stuff.
Well, talking about social stuff, what about social media? What kind of impact?
I'm not a fan of social media for teenagers. I mean, it has so many positives.
Sure.
It keeps people connected. They're able to communicate back and forth. It allows you to organize stuff. It allows you to see what's going on in the world. All that's really great. Until you get to the negative part that we have standards we can't meet. I'm never going to be a 175-pound muscle man again. And so it doesn't matter how many of them I see on social media and all the 70-year-old guys who have worked out with their Bowflex and this is what that's not going to be me. But when you're a teenager, peer acceptance and peer compliance is so important that social media has been very destructive to them. I think it contributes a lot to depression, anxiety, because they're on the social media with this standard they can't meet.
Well, I know so many adults who don't handle social media very well.
Yeah.
So how would we expect teenagers and younger people to handle it?
Who actually understand what buttons to push to do things. I don't. Yeah.
Well, there's just that, like you said, they're seeing. Well, then there's bullying even amongst.
It is
even amongst
very
adults. I've seen it.
Yeah. So when a kid comes in and tells me, "Yes, I have 1,500 friends on Facebook," no, you don't. You have 1,500 people that know something of you because they contacted you. But if suddenly somebody puts out to your 1,500 people that you're a stooge, everybody wants to join the crowd. And so you get this massive negative information. And a lot of them will choose to try and, quote, fight that. And then they end up very, very depressed because you have 1,500 people telling you, no, that's not true. I think it's a very, very big bully pulpit.
Yeah, unfortunately. What are some of the resources available for young people experiencing mental health problems in our area?
Well, I mean, you have a lot of different contexts through like the school settings. They definitely put a lot of personnel in the schools for kids to talk to. They're like Youth First and school counselors and teachers, and they're all there, and they most all want to help them out. If they're looking to reach out for a mental health professional, that's what we do solely all over, like to contact the mental health center. So we have a lot of different therapists, a lot of different locations. We have a west side location, an east side location, a downtown location, a location in each of the counties. We develop therapists that go into the school system to help supplement what the school has. And that program is going to be expanding into next year. We're going to be trying to put that into the outer counties of Warwick, Gibson, Posey. So our emergency services, you can call those, they are now mobile. So if you're in a situation where they need the person there are times the police notify us, we notify the police, and we go to a location together and actually work with the folks that are involved in whatever is going on, whether it's a domestic violence thing, a mental health crisis. Because a lot of times the police are there and it's like, that's not what I do. I control situations, I help people be safe. I don't do as much with this. We've helped train police officers to be better in that. And then now our crisis service can go out with them. Not in front of them, but when the police get it stabilized, we can come in and assess the person as to what their best needs.
I hear from other people that we still, even with all the things you just listed, that we still don't have enough in this area.
We don't. My caseload's over 100, and that's not unusual, unfortunately. So that means with all the paperwork that is required, I spend a lot of time on paperwork and not providing services. I have trouble getting people into my schedule at the frequency I want to see them. Sometimes we do intakes and we set them up for a wait list on group therapy because we don't have available what they need. That's getting a whole lot better. The last couple months, we don't have as much wait list stuff. We've done a lot to expand our groups, done a lot to expand individual therapy availability. We've added family therapy specialists in the two. So there's a lot that we do to keep expanding our services. If we get ourselves qualified for the CCMHC, we're going to be able to expand even further and provide more services. Whether you can ever meet the need, I don't know.
It probably isn't possible, right?
Yeah.
But at least it sounds like it's something we are improving upon.
It is.
All right. Well, thank you so much for being here.
Yeah, I'm glad you asked me to come.
Another group seeing the increase in need for mental health services for the youth in our area is Youth First. Joining us is Youth First President and CEO Perry Black. Thank you so much for joining us.
Thank you for having me.
So tell me, can you tell us a little bit, first of all, about Youth First and what you do?
Youth First work is all about strengthening youth and families, and we do that by embedding master's level mental health professionals in schools and providing evidence-based prevention programs that help young people develop resiliency and well-being.
So what are those positions called, in the school? Like you think of the nurse or the guidance counselor. When I was in school, what would they be called?
Our team are Youth First social workers and in some cases Youth First counselors, but they're primarily master's level social workers.
So then how does that work? Does a student say they're needing help or are they referred? How does that work in the school?
We are open to many different channels of accessing our support. So a student can self-refer, a student can refer a friend, parents can refer, teachers and administrators can refer. We welcome any referral, and then we can meet with the child once, and if we think it's the right procedure to continue meeting with the child, we ask for parent consent and then engage the parent in the process as well.
Well, good. So it actually involves the whole family.
It certainly does, and so many of the issues and concerns require all of us to wrap around young people and support them.
Yeah, because I can see where it would probably originate from the family. I mean, not that it's anyone's fault necessarily, but family dynamic would probably have a lot to do with it.
There are all kinds of reasons: environmental, peer pressure, trauma experiences as a child, maybe even trauma through the generations of the family. We can have a genetic predisposition to some of these challenges. So we recognize that the root causes are fairly diverse, but the approach to address those root causes actually is rather universal. How do we develop coping skills? How do we help young people develop their hope, their goals, their dreams, to bounce back from adversity? All of that is so important for us to live healthy, safe, successful lives.
So what are some of the youth mental health trends that we have been seeing locally?
Youth First has been around for 25 years. We were founded right here in Evansville and began to grow beyond Evansville over the years. We're now in 13 counties in Indiana, and we have staff embedded in 115 schools, serving other schools as well with just programs. And I have been with the organization almost 20 years. I can tell you that we have seen a very dramatic increase in anxiety and depression among young people. It has grown exponentially, and I don't think it's any accident that it has grown alongside the development of the technology and the social media channels that young people have access to.
Let's go a little bit over anxiety. What is anxiety? How do you determine someone has anxiety?
Well, I am not a clinician, so I can't really tell you that. But I can tell you that students exhibit things like being very uncomfortable in an environment. For instance, not wanting to go to school, feeling uncomfortable around other people. That has all also increased during COVID and post-COVID. So the isolation certainly has had something to do with it. Just the lack of self-confidence is a big issue. And anxiety, there is a clinical definition for anxiety and a diagnosis for anxiety. So it can be expressed in a way that it's not necessarily diagnosable, but that it causes the young person trouble just getting the most out of school and out of life. And it can be a precursor or related to depression. And all of those things are kind of wrapped up together. We also see anxiety often exhibited as anger. So an angry response to something may also be anxiety.
What can happen if someone doesn't learn coping skills, I guess, for lack of a better term, for anxiety? What can happen? Is that something that's going to really become worse as they get older?
I think it can. I think the idea is, there's so many ways we can address any of our challenges. And one of the ways we can address those challenges is first be self-aware. And so the Youth First team will help a young person recognize what's going on and then build some skills, help them develop some skills that they can use to respond to that reaction. So for instance, it could be as simple as some deep breathing techniques that will help them get back to a place of regulation. They call it emotional regulation, but just a place of calm and being able to move forward. It could be something like self-talk, positive self-talk. There are times in which you just have to remove yourself from the environment, maybe go to a space of calm. And many of our schools actually have rooms that are set aside for that now, that young people can spend a few minutes to relax, and then they can successfully go back into the classroom.
I know you touched on a little bit some of the factors that are causing this, and one of them was technology. I mean, is that also referring to like social media and?
Yes, and the research is growing in that area that seems to suggest that brain development is being impacted by the use of social media. and especially young girls are experiencing more depression. There's a lot of comparison going on. That I'm seeing this on social media. That's not me. I'm not able to, do the things this person apparently can do. Kind of comparing themselves to celebrities and so on, and that is making it a challenge for a young person to have the strength in their own being, their own who they are, and be confident in who they are. But the research is really rather fascinating that it may be changing how the brain is wired. So we need to prevent that from happening and help young people find limits. We can't probably restrict it completely because it's just a fact of life these days, but help young people understand what's going on and help them minimize the impact.
Can you give us an idea of resources available for young people who are experiencing mental health problems in our area?
In our area, if you're in Indiana, you can certainly visit youthfirstinc.org, and from there you can go to the link on our web page that is under About, and you can find where Youth First social workers or counselors are embedded in schools. It's a search engine. You can search by county, by school. You can also take a good look at the programs that we offer. Many of the programs we offer are for the whole family and are offered in the evenings after school and help develop that strong family bond, help develop the parenting skills alongside the kids developing their own skill sets. So take a look at all of our programs on youthfirstinc.org.
Well, thank you so much. And I mean, this is a situation that hopefully we can get a handle on it before it gets
Absolutely. We got to all work together.
worse. All right. Well, thank you so much for being here. The screening of Racing to Respond will take place on October 10th at Bally's Evansville. A reception will begin at 5 p.m., followed by the screening at 6 p.m., with a panel of local experts discussing the issue at 7 p.m. WNIN PBS will be airing the documentary at 8 p.m. on October 20th, followed by the panel discussion. Thanks again to all of our guests for talking about the youth mental health crisis in our area. Next week, we'll be looking at Medicare enrollment. Thank you for watching WNIN Newsmakers.